For the first time, UNAIDS releasing Global AIDS report with such alarming title, In Danger. And for me, coming from Ukraine, in danger means that we need to act. We need to act boldly, immediate, and with solid response. COVID-19 pandemic, economic crisis, food crisis, Russian war in Ukraine, monkeypox, all these things bringing world into the crisis. And this crisis pushed back HIV response, because with testing, with prevention, with treatment, we are, in some countries, slowed down, in some pushed back. In order to get on track, we need more resources. And report showed fundamental mismatch. When new HIV cases are going up, funding is going down. This is we need to take and address. And of course, looking at the global picture, we need fully funded global fund. Honestly, AIDS response for the next years will depend a lot how successful global fund replenishment will be. It will depend, would we raise $18 billion at least to save 20 million lives or not? Of course, this is very appealing to us. Even the slogan for the replenishment, fight for what counts, it really resonates with the report. And we don't have too much time. And US already made its very generous contribution, but we really need other countries to respond. We need, of course, increasing funding from PEPFAR and increased funding to UNAIDS as well. Russian war in Ukraine brought incredible challenges to my country. Over 100,000 people living with HIV actually living in the areas directly affected by the war. So many moved as internally displaced people or war refugees. Overall, we are talking about 15 million people, huge population. UN forecasts are so terrible. 9 out of 10 people will face poverty by the end of the year. GDP in Ukraine by the end of the year will drop by 30% at least. Losses for health system are so severe. So in the situation of such dramatic and huge impact on the war, actually civil society and community proved to be the backbone of HIV response. In many situations, it's not the infrastructure which saving lives, because hospitals were destroyed, roads were damaged. So it's actually people's efforts, social workers, community workers, peers, case managers, who kept contacts with the patients, allowing to distant support to continue a treatment, not to get people lost, keeping their motivation, which dropped so substantially, facing existential crisis and threats to life. And in some cases, governmental system didn't work, like for delivery of IRVs, for example, it was civil society organization who did this. Another example, opioid substitution therapy treatment. So we delivered medicines to all hospitals where government refused to go. They said, well, it's too risky for us. This is the turning point where motivation became the key driver to achieve results. And motivation of civil society is so strong. And in many cases where all others said no, civil society said yes. And for HIV and overall health response, it was a critical factor. Looking at the report, for me, actually, the shocking figures, how it's still very much driven by key populations. So 70% of all new infections linked to key populations. When we look at the risk factors, for example, this page, the biggest cycle, which illustrates the biggest risk to get infected, is for people who inject drugs. It's 35 times higher than among ordinary people. So if we know this, our data and knowledge should inform our response. So it's quite substantial changes expected getting out of this report. The big thing, and Winnie already highlighted, is human rights and gender, because we cannot support people who use drugs when they are criminalized, when they are put in prisons instead of offering treatment. So it's very critical also to know that a lot depends not on funding but on policies. For example, in our region, Eastern Europe and Central Asia, the war we are having in Ukraine started much earlier with Russian policy criminalizing people who use drugs and other key populations, refusing to provide treatment for people who use drugs with methadone and buprenorphine. It's critical to put science and evidence over ideology and prejudice. Otherwise, we will not win this battle. It's critical to understand that it's 100% true that we cannot win HIV battle without addressing human rights. And it's not happening by default. With the human rights, it requires a lot of efforts, a lot of resilience and readiness to fight, to rights to be adhered. That's our lesson from Ukraine. We are fighting not only for our territory, we are fighting for global fundamental values of our existence. Finally, we need to be quick. It's another take from Ukraine. Some of the decisions which earlier took us months and years to take, now we are proceeding in days and even hours. With such report in danger, we cannot be slow, because slowness in decision making also has its measurement. It's lives lost. So it's critical to be quick, because in our fight, we always should remember that we are fighting for people. And this is also our duty and obligation. So together we will win. Thank you.
Thank you so much, Andrew.